AAPC CPB Final Exams Questions and Answers. Verify D answers. Which of the following is not considered a part of the authorized process when the patient signs the consent for payment? A. Accept responsibility for any balance that is not covered by the patient's insurance. B. Authorize payment to the provider. C. Authorize submission of a claim to insurance company. D. Authorization for treatment. D. Authorization for treatment. A patient presents to the ER but is admitted as an inpatient for care. What copay is collected based on the insurance card for a participating facility? A. Not applicable. B. $15. C. $100.00. D. $75. C. $100.00. A patient calls the PCP office after hours and is told to go to the ER. What copay will be applicable to the ER visit? A. $25. B. $50. C. $35. D. $100. D. $100. Which of the following is true when entering patient data information into a PMS? A. The format of the information is not important but must be entered. B. Enter the patient information accurately from the insurance card and patient registration form. C. Assume the INF formation is correct. D. Review the information annually for correctness. B. Enter the patient information accurately from the insurance card and patient registration form. What process would not be performed at the checkout process? 1/3. A. Follow-up appointment TS. B. Review of charge ticket or encounter form. C. Collection of copays or deductibles. D. Patient registration process. D. Patient registration process. If your clinic has patients that do not show for their scheduled appointments, what would be considered a good clinical practice? A. Double book all appointments. B. Make reminder calls 1 to 2 days in advance. C. Charge as if the patient had been seen. D. Not schedule them again. B. Make reminder calls 1 to 2 days in advance. 28-year-old OB Patty, 1.0 point. 28-year-old OB patient presents with cramping, bleeding, and passing of tissue. She is diagnosed with a spontaneous abortion. Which ICD-10 CM code is reported? A. 002.89. B. 003.9. C. 020.0. D. 002.1. B. 003.9. OB patient at 36 weeks, 1.0 point. OB patient at 36 weeks presents with mild headache and leg edema. Her UA shows protein. She is diagnosed with pre-eclampsia and admitted for observation. What ICD-10 CM codes is / are reported? A. 014.93. Z3A. 36. B. R51.9. R60.9. C. 014.13. Z3A.36. D. 014.93. A. 014.93. Z3A. 36. A 5-year-old receives 5% third-degree burns on his right hand and also sustained 10% second-degree burns on his right upper leg after pulling a pot of boiling water from off the stove onto him. Total body surface area that was burned was 15%. What are the correct diagnosis codes for this encounter? A. T23.301A. T24.211A. T31.10. B. T23.301A. T24.211A. T31.10. X12.xxxa. Carrete 23.311. T24.211. T31. X12xxxa. D. T23.301. T24.211. T31. X12. B. T23.301. T24.211A. T31.10. X12.xxxa. 2/3. A patient PR is sensed with pain in her shoulder joint. What ICD-10 CM code is used? A. M25.51. B. M25.519. C. M25.512. D. M25.511. B. M25.519. The patient is being 1.0 point. The patient is being treated for acute on chronic pansinusitis. What ICD-10 CM codes is / are reported? A. J32.4. B. J32.4. J01.40. C. J01.40. D. J01.40. J32.4. D. J01.40. J32.4. The patient just turned 50 and is here today for a screening colonoscopy. During the procedure, 2 polyps are found and removed with a snare technique. What ICD-10 CM codes is / AR reported? A. Z12.11, K63.5. B. K63.5, Z12.11. C. K63.5. D. Z12.11. A. Z12.11, K63.5. Patient is seen for urinary symptoms that include nocturia, hesitancy, frequency, and a weak urinary stream. Exam reveals that the patient has an enlarged prostate. What ICD-10 CM codes is / are reported? A. N40.0. B. N40.1. C. R35.1. R39.11. R35.0. R39.12. D. N40.1. R35.1. R39.11. R35.0. R39.12. D. N40.1. R35.1. R39.11. R35.0. R39.12. Medicare provides a list of questions to ask beneficiaries that helps determine if Medicare is primary or secondary. Where can this information be found? A. Medicare Secondary Payer, MSP, Manual. B. Medigap Policy. C. CMS Claims Processing Manual. D. CMS Program Integrity Manual. A. Medicare Secondary Payer, MSP, Manual. Or Medigap, MG, and MGAP abbreviations for? A. Primary Coverage. B. Medicare Questionnaire powered by TCPDF, www.tcpdf.org. 3/3.